Thank you for joining us today for the UMP Plus Puget Sound High Value Network webinar. My name is Lauren Johnston, and I am a UMP account manager with the Healthcare Authority. Today, I'm joined by my network partners from Regence Blue Shield and the Puget Sound High Value Network. First, a couple of housekeeping items. If you have a question, please use the Q&A or the chat function in the webinar panel to submit your question. Only hosts and panelists can see your questions, and we will do our best to answer your questions as we can throughout the presentation or at the very end. If we do not get to your question, you can call either the Puget Sound High Value Network or UMP customer service for help in answering your questions. Please do not submit any questions that are specific about any care you are receiving, a claim, a diagnosis, etc. Those questions should go to UMP or Puget Sound High Value Network's customer service teams. There is a live transcript available during the session. Please click on the live translation button to turn it on. And I believe we actually have a service that is transcribing as well. In a few days, the recorded webinar will be available on HCA's YouTube page, as well as the pages for Puget Sound High Value Network. Today's agenda includes a walkthrough what UMP Plus is. The Regence rep will walk through some of their programs and benefit changes for 2025. Puget Sound High Value Network will go through some plan highlights and which partners are included in their network. We will show you how to look up a provider you currently see or might be interested in seeing, and we will provide some resources on how to enroll, as well as wrapping things up with a Q&A and where to get more information. You may be asking, what is an accountable care network, also referred to as an ACN? An ACN is made up of providers such as primary care providers and specialists who work at clinics and hospitals. In an ACN, these groups of doctors, hospitals, and other health professionals work together to give patients high quality, coordinated services and healthcare to both improve health outcomes and manage costs. Coordinating your care means providers who are part of an ACN work together to ensure patients get the right care at the right time. By working together, these providers can reduce healthcare costs caused by many things, such as unnecessary or duplicative tests and procedures, and by promoting preventive care. This ensures everyone is on the same page about what treatment you are receiving, which drugs you are on, or whether you need testing or labs done. When HCA set out to create the ACNs, our goal for members was for them to receive better care through the collaboration of providers that I just described, reduce duplicative and necessary medical services such as labs or diagnostic tests, and improve the long-term health of enrolled members in the hopes of preventing serious health issues or hospitalizations. UMP Plus is the medical plan that is made up of two ACNs that are offered by the PEBB and SEBB programs. The two ACNs are the Puget Sound High Value Network, which we are discussing today, and the UW Medicine ACN, which is presented in a separate webinar on Friday. The UMP Plus plans have been in effect since January 1st of 2016 for the PEBB program and January 1st of 2020 for the SEBB program. Since its enactment, UMP Plus has seen large increases in membership, with enrollment currently at more than 47,000 members. UMP Plus offers lower cost shares for some services, as well as a lower deductible, all offered through a local network of doctors and specialists. Diving further into some of the perks of being enrolled in the UMP Plus plan, again, it offers a lower medical deductible, which is $125 per person or up to $375 for a full family. If the subscriber on the account has earned their wellness incentive through Smart Health, the subscriber's portion of the deductible is $0. Therefore, if it's a subscriber only account and they earned their wellness incentive, the deductible is $0 for the year. There is also no annual pharmacy deductible. The UMP Plus plans offer free office visits with a primary care provider. However, please keep in mind that some related services, such as x-rays or labs, may be subject to the medical deductible and coinsurance. Some reasons to consider enrolling in a UMP Plus plan. It focuses on coordinated care within a network of providers who work as a team. It offers a full range of specialty care and specialty providers, and members have access to the Regence network of non-primary care providers, also referred to as support providers. These providers include physical therapists, labs, chiropractors, naturopaths, and massage therapists, amongst many others. This slide is a brief side-by-side comparison of UMP Classic and UMP Achieve 2, UMP Classic being for the PEBB program and UMP Achieve 2 being for the SEBB program, compared to the UMP Plus plans. As stated previously, the UMP Plus plans have a lower medical deductible, no pharmacy deductible, and you pay $0 for the primary care provider office visit versus 15% on the UMP Classic and Achieve 2 plans. Next up, I'll discuss who is eligible for UMP Plus. The Puget Sound High Value Network has a service area which covers King, Kitsap, Pierce, Snohomish, and Yakima County. A subscriber must live in one of these counties in order to enroll in the UMP Plus Puget Sound High Value Network plan. You must also be an employee and their enrolled dependents, a PEBB or SEBB continuation coverage on unpaid leave member and their enrolled dependents, a PEBB or SEBB continuation coverage COBRA member and their enrolled dependent not enrolled in Medicare Part A or B, or a retiree and their dependents enrolled in the PEBB program, but not enrolled in Medicare Part A or B. It is important to acknowledge that the UMP Plus Puget Sound High Value Network plan won't be the right fit for everyone. There is more to consider about this plan than just the lower costs. Subscribers should live within the UMP Plus network service area. This plan may not be right for members who prefer to see primary care providers, specialists, or receive services at hospitals who are not in the Puget Sound High Value Network's provider network. If you prefer to see UW Medicine, Multicare, or Providence providers, those providers are out of network for this particular plan, and you will likely pay a higher cost share. You may want to consider a different plan if your dependent child does not live in one of the counties mentioned earlier or lives out of state, for example, attending an out-of-state college. If you yourself live out of state for part of the year or if you yourself will be out of state for part of the year because there will not be any in-network providers available to you and you risk paying higher cost shares. Next up, my network partner from Regence Blue Shield will walk through some changes and benefits for the 2025 plan year.
Good afternoon. My name is Ashley Litt, and I work on the UMP account management team at Regence Blue Shield. Open enrollment begins October 28th and ends November 25th. UMP Plus Puget Sound High Value Network, also referred to as PSHVN, will no longer be available in Chelan or Douglas counties. The counties that make up the UMP Plus PSHVN network includes King, Kitsap, Pierce, Snohomish, and Yakima counties. This plan is available to you if you live in one of those counties. Need extra support managing your diabetes? In 2025, both PEBB and SEBB members will have access to a new diabetes management program that offers personalized support. Routine vision coverage will be separate from PEBB medical coverage in 2025. Non-Medicare PEBB and SEBB subscribers will be able to choose from 3 vision plans: Davis Vision by MetLife, iMed Vision Care, and MetLife Vision. The company administering your prescription benefits is changing its name to ArrayRx. Our new smoking cessation program offers more support than ever to both PEBB and SEBB members. Now you have access to a dedicated care team, unlimited to one-on-one coaching, personalized mobile content, and nicotine replacement therapy. The plan comparison shows you a side-by-side view of the 5 different plan choices: UMP Select, UMP Classic, and UMP CDHP plans are all available for enrollment worldwide and include network access to preferred providers worldwide. UMP Plus PSHVN and the UMP Plus UW Medicine ACN are available to you in their select counties. Each plan has an annual medical deductible, and some have annual prescription deductibles. The deductible is the fixed dollar amount you must meet each calendar year for services before the plan starts paying for covered services. Some items, including covered preventive services, are not subject to the deductible. Each plan also has coinsurance, which is the percentage of the allowed amount you must pay for the provider on claims for which the plan pays less than 100% of the allowed amount. The annual out-of-pocket limit is the most you pay during a calendar year for covered medical services when you see preferred or network providers, and for covered prescription drugs and products when you use a network pharmacy before the plan pays 100% of the allowed amount. Most plans have separate out-of-pocket limits for medical prescriptions. Your network telemedicine options can be explored using ump.regence.com or by calling customer service. Costs for telemedicine visits with a network provider will be no more than you would pay for an in-office visit and may be subject to the deductible. Advice 24 is available 24 hours a day, 7 days a week to UMP Plus PSHVN members at no cost. When you're not feeling well and you're not sure what to do, a registered nurse can help you with the information and support your needs. UMP plans offer a variety of programs to help you improve your health. Learn more about these programs, including cost, eligibility criteria, and how to participate on the UMP website. Programs include diabetes programs, diabetes management, palliative care, maternity support, expert second opinions, tobacco cessation, and virtual self-guided behavioral health support, formerly MyStrength, now Teladoc Health Mental Health. When you create an account for use on the Regence app and regence.com, you'll have a personalized experience tailored to your UMP plan benefits. Just have your member ID card handy when you create an account by downloading the Regence app or going to regence.com. The same account can be used for the Regence website and app. With your personal online account, you can see all member-independent health information and solutions in one place, get personalized recommendations so you can make informed choices about your health, have convenient access to virtual care, easily estimate costs for procedures and services, and connect with your health and well-being programs. Enjoy a single integrated experience across the Regence website and mobile platforms, and access ArrayRx with one username and password in the Regence app and regence.com when you sign in. After you create your online account for regence.com and the app, every time you sign in using your username and password, you'll go directly to your home screen, also known as the member dashboard. You'll notice this dashboard includes accumulators that are higher than the UMP Plus PSHVN plan, as this dashboard serves as an example of the layout. However, it displays the classic accumulators. Think of it as your member dashboard where you can find useful information and resources, including claims, where you can view your claims and their status. You can view your plan's benefits and coverage. You can view your deductible and out-of-pocket max balances, find a doctor or provider in your plan's network, and pull up a digital version of your UMP member ID card. Next up, we have some frequently asked questions. Are referrals needed for anything? No, referrals are not required on any of the UMP plans. How do I find out if my provider is in my plan's network? To find out if a provider is in your network, visit the provider search feature on the UMP websites listed below. How are benefits coordinated if I have other medical coverage? If UMP is your secondary plan, it is non-duplication of benefits. This means UMP will only pay up to what it would pay if it were primary. Here we have two examples. The first example, the primary insurance pays $100. UMP would have paid $100, so UMP pays nothing. The second example is your primary insurance pays $80. UMP would have paid $100, so UMP pays $20. Is massage therapy covered? Yes, massage therapy is covered as long as you use a network provider. A prescription from a doctor or a chiropractor is needed. Is there coverage outside of the country? The Plus plans are for services inside Washington state. If you travel outside of the state and have a medical emergency, the plan will cover at the same rate. For non-emergent services, the plan will pay 50% of the allowed amount after deductible, as there are no in-network providers outside of Washington state. Are virtual visits covered? Telehealth virtual services are covered under all UMP plans. Now I'll hand it over to Kristen at PSHVN.
Hi, everyone. My name is Kristen Pappas-Burai, and I will be sharing information and representing Puget Sound High Value Network on this webinar today. So the Puget Sound High Value Network is comprised of some of the highest quality healthcare organizations in Washington state. As you can see here, some very familiar logos, I'm sure, to you. We provide flexible, affordable healthcare for members of both the PEBB and SEBB program in King, Kitsap, Pierce, Snohomish, and Yakima counties, as we mentioned before. We're really proud to have some of the highest quality and most well-known health systems in our network. PSHVN is comprised of some of the top performing organizations in the nation. Our hospitals and physicians have been recognized as top performers by many leading rating systems and information sources across the industry, including Leapfrog and Health Grades, which are two very prominent rating systems. So as Lauren touched on before, we do offer a full array of services that should cover any kind of care you might need, ranging from primary care to the most specialized and advanced specialty care. There's also free office visits when you use a primary care provider that's in the network. And we have over 2,000 primary care providers. And then services like x-rays, labs, those may be subject to deductible and coinsurance, but again, that office visit is free. And then we do have a very large network of urgent care clinics. And this is just a graphic to show truly how numerous our locations and services are. So again, over 2,000 primary care providers to choose from, over 8,000 specialists, 1,200 clinics, and 15 hospitals. And then we do have a very large range of urgent care centers. And our services also include any kind of emergency care. We also have trauma centers. And then for any long-term needs, we also have home health and then hospice. And we also offer a 24/7 nurse hotline, which I'll touch on more in a future slide. So a huge focus of an accountable care program is preventive care. And really, we feel that that is driven in the primary care setting. So we place a high emphasis on the doctor-patient relationship, and our PCPs can act as essentially the central hub to coordinate all of the care, and then also help in navigating the extremely complex world of healthcare. Here you can see three of the kind of concierge services that we offer. So dedicated call center. It has very long hours. So I believe it's 7 to 7. I have it on a future slide. But really, we're there to answer any and all questions you may have regarding the Puget Sound High Value Network, who's in network, who's not. We also have the option of going to the website. This is very easy, and I use it all the time to just plug in any type of provider or specific provider name, and it'll tell you if they're in or out. And then, of course, all of our health systems that are part of our network have patient-specific web portals, like MyChart, where you can go in and view your full medical record. So talking specifically about the dedicated call center, they can help you with things like scheduling and facilitating appointments for both primary care and specialty care. Anytime you need help locating a clinic or a provider, and then also help identifying the urgent care centers. They also can just transfer you or connect you with a 24/7 nurse health line. Like I mentioned, they are open 7 a.m. to 7 p.m. So it's a pretty broad range and usually can, if they can't answer your question, can direct you to where to someone who can, such as Regence, for example. And this is just a graphic of the website. So going on there, you'll find all the provider logos who are included to make it kind of easy. So if you know your doctor's part of the polyclinic, then you're set. And UMP Plus PSHVN is perfect for you. But sometimes it's not so clear. So just plug in the name of the provider, search, and it's tied into our roster. So if that provider is part of the network, it'll show it. And then Lauren will talk about more information on how to enroll. Thanks, guys.
Thanks, Kristen. If you'd like to learn more about the plans and benefits offered under the PEBB and SEBB programs, you can visit the Healthcare Authority's virtual benefits fair page at the links listed on this slide. When you are ready to enroll, you can do so by either visiting the new login page at benefits247.hca.wa.gov or hca.wa.gov/ERB. You'll want to click on your member type and then log into Benefits 24/7. Or you can complete and submit the appropriate 2025 enrollment change form, which is available at hca.wa.gov/ERB. But paper forms must be received by HCA no later than November 25th. If you'd like to speak to someone in person about the plan, you can visit the Puget Sound High Value Network booth at any of these benefit fairs. And at this time, we are open to taking questions. Again, if you have questions, you can visit Puget Sound High Value Network at their webpage listed there, or you can call either of the numbers on this page if you are a PEBB or SEBB member.